Afternoon, everyone. Hello, good afternoon. Welcome to our second Bridges podcast. And the episode we want to talk about today is surviving the hospital bubble, as I like to call it, because when you're ill or you have an injury or anything bad happens to you and you need to be in hospital for whatever long period of a time, I like to think of it as you actually end up being in a bubble. So it's a very different life and it's life-changing. And I have some lovely people here with me again. You may remember them from the last podcast. So there's lovely Scott and Claire. And for those that don't know them yet, please can you introduce yourself? Claire.
Me first. Hi, I'm Claire. I've been part of Bridges, and that's how I know Evi and Scott, and I do some of their self-management training. I came to kind of the world of patient experience stuff through, I was diagnosed with cancer when I was 17, and had treatment for a few years. Thankfully went into remission, but I now live with a few long-term as a result of that treatment, which means that I'm in and out of hospitals quite a bit, actually. So I was when you said that it was all about inpatient stays, I was like, this is my jam. I know about this stuff. So this all these questions very pertinent. So yeah, I'm really pleased to be here. Thanks for asking me.
Of course, thank you. And then Scott, lovely Scott.
Yeah, thank you very much. So yeah, I'm Scott. I also work for Bridges. I am a stroke survivor. Had my stroke back in 2007. And I worked out earlier on, I spent a total of nearly a year and a half in hospital, all told. So yeah, quite a long period of time in hospital then. And then was also thinking about what time have I spent in hospital since then, and I had an unfortunate kidney stones incident. I think it was 3 or 4 years ago, and then last year as well, I managed to fall over and break my leg as well, and was in hospital for I think it was 3 or 4 weeks as well. So have a bit more recent experience that I can try and draw upon as well. So yeah, that's kind of my hospital stay experience.
Lovely, thank you, Scott. And me, lastly, again, it's Evi, and I'm a major trauma survivor. About 5 years ago, I was involved in a very bad car accident. I wasn't as long in hospital as you guys, but I spent good 2 months there. And then I was in and out of hospital on my journey to recovery with various setbacks, like having a nerve graft in my arm or having another major operation on my pelvis. So starting all over again. And then just little bits and bobs and pieces, but nothing as big. But I think that time doesn't really matter. It doesn't matter if you're there a week or a month as such. But anyway, so yes, guys, so we are here, and what was it like for you to start with, and how did you feel? How did we feel?
So I'll go first.
Yeah, you go first, Scott.
Sorry. So it was a really odd experience for me. So I trained as a physio beforehand, so I'd actually spent a lot of time around hospitals, and thought I knew a lot about hospitals. It's actually only once you spend a lot of time in hospital as a patient you really understand what it's like to be in hospital. Like all the weird noises that go on at like 2 or 3 o'clock in the morning, the weird kind of patterns, the kind of whole being woken up at 6 o'clock in the morning to go for a shower, which I never really understand why that they kind of insist on doing that sometimes. The food, which I'm sure if you speak to anyone about their hospital stay, what is the one of the one of the worst things about the hospital stay. A lot of people remark on the food, and for me, somebody whose life pretty much revolves around food, was a big deal for me. But also the kind of access to your family and friends and stuff as well was weird. So I was in, as I said, I was in hospital for a year and a half. I was very lucky. I had my own room for that period of time. But it was a big kind of strain on my family and friends to kind of come and visit me, and it was a weird environment for them to come and visit. But to me, it kind of become a bit more like home. But yeah, for them was a slightly weird environment to kind of come and visit me. And Claire, what was it like for you?
Yeah, I mean, I relate to a lot of that. I guess the difference between us, when I first got admitted to hospital, it was before I was diagnosed with the cancer, so I didn't know what was wrong, and it was a sort of 4 or 5 months of being in and out with symptoms that were problematic. But I was only 17 as well, so so I was just trying to think back about what I think when you spend a lot of time in hospital, you get used to what is essentially a really weird system, like you were saying, the kind of a really unusual place to be. And often I'm reminded when people come to visit me who perhaps haven't been in very much, the look on their face reminds me of how bizarre the whole situation is, that you're all in you're in a room with 6 other people all in bed. I mean, that for starters is odd, isn't it? Like, that's not something you but I just remember, so when I first was admitted at 17, I was really scared, and I remember thinking back to, I was put on an adult ward, and as with a lot of general medical wards, a lot of the people were really old, and a lot of people had dementia, and there was a lot of confusion and chaos, and just sort of, I'd be put in this room with sort of maybe 6 beds and maybe 3 or 4 people who really weren't very with it, bless them, and were really struggling, and were lots of noise and shouting, and just the kind of the realization that I was expected to get better in this environment. It kind of, I found it really shocking. I was like, what? So I can't sleep because, well, firstly, like Scott said, you get woken up at all sorts of odd hours, but also the noise from other people in the room, and the other machines, and the staff coming in and out for them. And so I can't sleep, I can't eat what I want, I can't eat when I want, I can't get, like all the things that kind of are really part of recovery that we do at home. We sleep a lot, and we eat nice food, and we eat well, and all those things are just not there. That's, not to say there's a solution for that, but it's just, I think we have to remember, when people haven't been in a hospital before, it's all so shocking and unnerving. So, yeah, early experiences. I mean, now I've really, unfortunately had to get used to it, and they do feel like a second home, and I go into a different mode, and I know what I need in there. And I kind of, the thing I struggle more with now is about carrying on self-management of your condition that you know so well, in an environment where you are not in control, and you can't, there are rules about what you can and can't do, and those rules don't fit with what you normally like to do for your condition. Then do you stop looking after yourself in the way you normally do? That's the bit that I now struggle with. How about you, Evie? What were your experiences? I imagine similarly, like a shocking introduction to the hospital system.
Oh my God, yes, and I resonate with everything. I'm just thinking, oh my God, I'm just going to repeat everything you said. It is, for me, I was 35, I was single, my whole family in Czech Republic, so I didn't really have a family support behind me. And I remember ambulance trying to get me to hospital, and I was in West Sussex, and I realized I'm actually in London. I was like, where the hell am I, and how long am I going to be? And it's been really scary, because I think the worst thing for me were the first few days, because I had no answers to anything. No one was telling me how long am I going to stay. There was a possibility of shifting me elsewhere, but where? And no one knew when and how, and who do I speak to? And I felt a lot people didn't talk to me. They talked about me to people in front of me, but not to me. So I think that was the worst experience for me about that. And as you say as well, the noises that it's just when you talked about it, I just all clumped up because I remember the beeping noises, and then in the night they would rush in another people that had major trauma, and they just shut these curtains around that bed, and you just see this shadow game, and it's really scary, and you don't know what's happening. People screaming. As you said, I was on orthopedic ward as well. They were older patients as well, and some of them weren't with it, and they were understaffed. So it is just it's a completely new environment, scary environment that I felt I wasn't introduced to or told much about the rules either. So I didn't know what I can do or I cannot do, what acceptable. So at the start for quite a while, I just accepted whatever was done to me or prescribed to me, and I didn't challenge. And as you mentioned, guys, out of control completely. And I don't think it has to be that way. I learned that I can take some control, I can ask for control. And I think that's one of the most important things for me that I learned, that take control over something for me became very crucial. And finding a friend, finding someone I can trust from the medical staff. So yeah, but that we're going to come to it because I was thinking about this topic a lot, and what were the pros and cons of hospital stay? Because you are in there, it's a new world to you, and it's not all bad, it's not all negative. So can you pick any good bits about being in a hospital? I wonder. I know that for example, if I can start it off, guys, what I really liked actually sharing the room with other patients was I got a great peer support from them. We could talk about stuff that I didn't feel confident to talk to my doctors or anyone, any medical professional, because it could be embarrassing. Like I couldn't go to toilet for number 2 for 21 days. I was bloated, it was hurting me, I was petrified to go. So I just decided I'm not going to go. And but I would not talk about it to the medical staff. They would ask me, and I would shyly say, well, I'm okay. I don't need to really, because that would mean for me to move. And with my injuries, broken pelvis, fractured spine, legs and arm injuries, that was an incredibly painful image of me trying to move to position that I would go to toilet. So I decided not to go. But actually talking to Sheila, who was incredible patient next to me on a bed, and she was slightly older than me, and she had similar problem, and we could talk about this, and we gave each other advices and tips, what worked, what didn't work, that we had to help ourselves. And I would never be able to share that with people, or about fatigue, or about actually being scared to do physio, to do our first step, because I can fall, I can hurt myself, but I would never share it with my physio because they were so excited, and this is a big step, and you're getting better. So I felt I needed to be excited too, but inside I was really scared. So talking to fellow patients really helped me.
Yeah, I can completely. I think I've always thought about when you do find someone on a ward or on a bay that you kind of connect with, or you have a comparable story, or I always feel it's a little bit like when soldiers talk about when they've been battled together and no one else really gets it because no one else was there, and they're not there on the kind of the minutiae of the day to day. And I just feel you have these amazingly intense relationships with the people in the next bed, and then you don't ever see them again normally. Normally it's not a kind of, we're not encouraged to kind of stay in touch. And it's a funny world where I've had these series of incredible kind of few weeks here and there, or a month with Mrs. XYZ in the next bed. But I do think they can be incredibly supportive relationships, and when they work and when people are able to do that, for sure. And I think the same really, relationships are the things that stand out to me. I can still remember the faces of doctors and nurses who were brilliant,
Yeah.
And I mean, we're talking 23 years ago nearly was my first hospital admission. So I can still remember the doctor in that first admission who was kind and reassured me, but was honest and said he didn't quite know what was going on. And actually, you know, whilst he was worried, it wasn't, you know, he just did it in such a way. So I think they, you know, there is the capacity for people to have such a huge impact on your life, even in that small moment.
Yeah. And it doesn't have to be big, does it? It can be just a small thing.
Yeah. So I still I remember some of the best treatment I've had, and I'll probably remember that forever because it had such a big impact. Yeah, I think the other thing I'd say is it's something that I've noticed has really changed over time. So when I first went into hospital, I mean, it doesn't feel like it should be that long ago, but you know, the concerns still come around white coat.
You're cutting out a little bit, Clare.
I mean, that's. Oh, am I? Sorry. At all? Is that any hear me?
Not really. Maybe try. Sorry, guys, who's listening? We're having small technical issues, so I would like to sing you a little song while we try to sort it.
It sounds like you've come back now.
Yes.
Am I back yet?
Yeah.
Yes, a little bit. Yes.
Yeah. Okay. Sorry, chaps. That's what I was going to say. Is it's changed a lot. I don't know if you caught what I was saying, but when I was first admitted, the treatment was very impersonal. People didn't introduce themselves. People talked about you at the foot of your bed to lots of medical students who they didn't ask whether it was okay to bring them. All that kind of thing was still going on, and it's changed a lot. And I think the thing that's changing even more now, which I'm really pleased about, is the kind of a move towards trying to support people to keep, if you've got a long-term condition, keep managing it yourself as much as you can when you're an inpatient. Because I think, so I had an admission where they were like, well, you can self-administer all your drugs. You know how to do that. You probably do it better than us. You know, you can schedule, let us know when you want to get up in the morning. Let us, you know, and that was such a great experience that, I mean, I would never say staying in hospital is a great experience. So to take that back, but you know, such a contrast to what I'm used to. That shifting kind of who has control in this situation. So that's been a good change that I've seen definitely over time.
What about you, Scott?
Yeah, I think for me, so kind of going back to the peer support aspect, a really big one for me was, I think I'd been in the inpatient unit. I was kind of having my recovery at. I'd been there for about 2.5, 3 months, and I was really craving like a bacon sandwich. And I was chatting to a guy in the room over the corridor from me. I was like, oh, I'd do anything right now for a bacon sandwich. He was like, well, just ask one of the healthcare assistants to take you down to the cafeteria. I was like, what, I can do that? He was like, yeah, of course. As long as they're not too busy, they'll take you down there. I was like, this was like mind blown. So I tried it the next morning, and the healthcare assistant was like, "Oh yeah, I'll take you down there." So that was it. I was like, from then on, like 2 mornings a week, I would go down to the cafeteria for a bacon sausage bat, and that was just my like solace then. And this guy, his name was Dudley, would me and him would go down to the cafeteria for a cooked breakfast like 2 mornings a week, and that was just that getting away from the rehab unit was everything I needed. And the fact again that it revolved around food. Anyone that knows me won't be surprised about that. But it just gave me that kind of escapism that I needed. But also kind of, Claire, coming on to the point that you just made about care being a bit more like allowing people with long-term conditions to manage their own care. So a few times when I've been in hospital, they like one of the first things they'll do is they'll take any medication that you've got
And
off you, and they'll just be like, no, we'll administer all of your medication. And more recently, when I've been in, they will, I think it may be because I'm on some slightly weird medications and they struggle to get it, even the hospital dispensaries, but they'll be like, oh, actually, you know, your medication's in dossier boxes. You can administer that yourself. Just let us know when you've had it so we can mark it up on your chart. But that small act is really important because it still gives me some degree of power to be able to have my medication as and when I would normally have it, which is a really big one for me.
yeah,
So yeah, you know, those kind of small ones, and I'm sure there's huge amounts of hospital bureaucracy behind allowing patients to bring in their own medication and take their own medication, but actually if it's sealed and in dossier boxes and has been and has been issued by a doctor and the doctors on the ward recognize the need for this medication and they would just be issuing it anyway, then what's the harm? So yeah, that was those are kind of some examples for me, really, I think.
yeah. And I remember also, I think this goes with me about knowledge too. Well, I learned a lot by staying in a hospital because, to be honest, I did have my share of accidents, but I was quite little. I was hit by a car when I was 5, don't remember that. And then I was in and out of hospital, but that was in Czech Republic. So my experience from hospitals was very different to England. The medicine over there is have brilliant doctors, but incredibly prescriptive. So when I was hospitalized over here, to be honest, I mean, I didn't even think about it. I just expected it to be the same. Plus, I learned that a lot of doctors or medical professionals in general assumed I have the knowledge. Let's say about pain medication that I can ask for for example, for first 10 days of my stay in hospital, I knew I'm getting medication because they always turned up with my medication, right? They told me you're taking morphine, codeine, ketamine, you're taking XYZ, 12 different painkillers 4 times a day. You're dosed up. You don't really know much. And but that's what they're giving you. They're the experts, right? And I was in incredible pain. And then 10 days later, the pharmacist talked over with the pain specialist, and they look at me and they go, "Hiya, can we have a chat?" I'm like, "Yeah, sure." And they go, "Are you in pain?" I'm like, "What?" I looked at them like they're crazy. Of course I'm in pain. I mean, come on. Yes, I am in pain. Why? Are you sure? I'm like, yes, I'm sure. Well, you're not really asking for any additional pain medication. And my jaw dropped. And I said, what? Like, I can ask for more? And they're like, yeah, you can have more. And I remember I stretched my hand and I tapped it. And I'm like, pump me up. Come on. Where is the, And they explained to me that every 2 hours I can ring the bell and have more pain medication if I need it. You cannot believe how much it helped me to do physiotherapy, for example, because I was in less of a pain. But they assumed that I would ask if I'm in pain, I would ask for more painkillers. I mean, when I think about it, it makes sense. But to me, as a new patient, I was already getting so many painkillers that I didn't think I can ask. So just, I think to be aware of assumptions, but also for me, that not to be afraid to ask, if not to expect them to understand that I don't know, that it's a new experience for me. So I remember that was quite funny. Well, not funny, I was in a lot of pain, but
yeah. It kind of comes down to as well that I think when you go into hospital, you quite often fall into a sort of dependent role because that's the kind of dynamic that's set up. Someone is caring for you, they will do things to you and about you, and there's not there's not much a kind of empowering language used. And the first question isn't what do you think or what do you want? It's normally, this is all the information. We might give you a few options later down the line. And then, and therefore it kind of feels, I don't know, it feels very unnatural to say, actually, I want to do it this way. And can you change your system to accommodate my needs? And which are all completely legitimate within hospital. And actually, I think it's a sign of good kind of recovery. You know, you're sort of taking a bit of control back and stuff. But it doesn't feel like that's something you can do when you first arrive. I think it takes a long time of being in there to go, oh, wait. And also assuming that the systems are fail-safe. And whilst, you know, it's not a criticism, there are kind of things get missed and bits, and it takes a while before you realize that actually if you've noticed you've missed a drug, it's completely okay to ring them and tell them you've missed a drug. You know, it's sort of it's a sort of a game of two parties, both involved in this getting better. Not to assume that you shouldn't be part of it, I think.
Scott, I was thinking, have you ever come across a medical professional where you felt safe to either challenge maybe a treatment or your therapy session or your medication, where you felt that you can actually say, hold on a minute, I don't like it, or I do, or I would like to do it differently? How was your experience with medical professionals towards you? Or maybe doctors and different medical professionals?
Yeah, so when I broke my leg last year, so I broke my leg on a Friday, and over the weekend, the only specialists that were in were upper limb specialists. They're like shoulder specialists. So it so happened that I wasn't able to get anybody to come and look at my leg from a surgeon point of view until I think it was the Tuesday. And being previously a physio in another life, I was very conscious that I needed to get I needed to kind of do something to maintain the range of movement in my ankle and my leg if I was going to, because I was probably going to have some kind of operation on my leg. So I needed to do something to maintain range of movement in my ankle and in my knee. And so very early on, I was like, can I see the physios, please? And the nursing staff were like, oh, okay, yeah, we'll see if we can get the physios to come and see you. And no physios kind of materialized. And I kept asking to see the physios, and no physios materialized. And I ended up getting quite forceful in my request to see the physios. And eventually a physio came along who was quite clearly was a bit miffed at being summoned by me, for want of a better phrase, to kind of come and see me. And I was like, look, I appreciate you probably don't want to come and see me until you know, one of the consultants has been to see me, but we both know if I sit here doing nothing, then I'm going to lose range of movement at my ankle. You know, just sitting here waiting for something to happen, purely because of the fact that I've had the misfortune of having an accident on a Friday, and there's not any lower limb specialists in over the weekend. So is there something that we can do to, you know, to try and maintain ankle range of movement? And they kind of muttered and grumbled a little bit, and eventually they did. I said the other problem that I've got is that the swelling around my knee is really bad. You know, can I get some ice on this knee? And they're like, oh no, I'm really sorry, we don't allow ice on the ward. I was like, this is like a major trauma orthopedic ward, and you don't allow ice. Like, surely this is one of the major treatment things that you allow in your you know, in your kind of toolkit. And she was like, oh no, I'm really sorry, we don't have that. So she went away and had given me some exercises I could do to kind of use to kind of get my range of movement on my ankle. And a healthcare assistant came along to see me a little bit later and was asking how I was getting on. And I was like, oh, yeah, things are okay, but I'm really worried about swelling on my knee. I'd love to be able to get some ice. And he said, oh, leave it with me. So he went downstairs to a Cafe Nero, and they weren't, I think it was quite cold outside, it was like March or something, they weren't using their ice. So he basically said, I've got a patient upstairs who needs some ice. Can we have some of your excess ice in a plastic bag? And they were like, yeah, of course. So they filled up a plastic bag with ice. And he came back into my room with a plastic bag full of ice, a wet towel with the plastic bag in, and was able to put it on my knee. I was like, this is just brilliant. Like, this is fantastic. And the physio walked back in my room a little bit later, and she looked at my knee. She was like, what's that on your knee? I was like, oh, I managed to get some ice from somewhere. She's like, where did you get that from? I was like, oh, I managed to, managed to get somebody to get some for me. She was like, to be fair to her, she was really good. She was like, well done. I'm very impressed at your resourcefulness, and yeah, I hope it does a good job for your swelling. But yeah, it's kind of a bit of a frustration that you like. I knew that I could fight or could argue my point to a healthcare professional, but there's lots of other people who don't really feel that they can argue those kind of points with their healthcare professionals, and they have to kind of take what is said to them as gospel, and they can't push it any further. And yeah, it's a real shame, and it's a real sticking point, a sore point for me. I don't know if either of you have had kind of similar experiences or kind of similar things.
I really, really recognise that situation of you. I mean, you've got an expert in both senses of the word, as a kind of long-term patient, but also as someone with physio training. You'll kind of fully know what's good for you and what will work. And I find just being someone who's lived with a condition for as long as I have, you know what you need sometimes. And it's I still find it a really hard balance going in. I almost always have to be admitted through A&E because I get these flare-ups. It's not like it's a planned admission. Trying to kind of advocate for myself and be forceful and not accept things that are no good or won't work, without being seen as being a difficult patient or being a bit strident or being a bit demanding or she thinks she knows, and to be fair, sometimes I get reactions that are brilliant and are like, you know best, you tell us what we need to do and we'll do it. And it's such a relief when that happens, that feeling when you're like, oh gosh, I'm being listened to. And but I mean, still to this day, I've got, every time I go in, I need IV access for antibiotics and other drugs. My veins are predictably terrible after as many years treatment, and that you can't get cannulas into me. And almost without fail, I'll go in and say, I'm really difficult to cannulate. And they're like, oh, don't worry. I do this all the time. I do hundreds of these every day. And you're like, I know. And I do appreciate that you're probably really good at your job. I get that. I'm just saying, and I'm not saying this is I'm a bit funny about needles. I'm saying I've had hundreds of admissions. On every admission in the last 8 years, they've had to call the anaesthetist. Like, nobody's managed to get a line in me differently. You need the ultrasound, you need to find the veins at the, I know sort of, and I find myself trying to drop in words to show that I know what I'm talking about, like trying to drop in the names of different lines that I've had and access and interventional radiology, and kind of trying to get them to see that I know what I'm saying without being seen as demanding. And it's just really difficult. You feel like, gosh, I wish there was just like, you could almost pass a test. If you sit at hospital,
I'm level 4 expert patient.
level for it. You can trust what I'm saying.
Yeah.
Like, you can believe me when I tell you that please don't try 8 times to access a cannula before calling you anaesthetist. They say, well, the anaesthetist won't come unless we've tried first. And I'm like, what kind of system is this? It's madness. So we have to go through this, facade of trying to get a line in that I know is not going to work, so that we can say we tried, so that we can go to the next level, which I know is inevitable. And so there are still, I think, even when you are someone who knows your stuff and you know how the hospital systems work and you know what to say sometimes to get the right treatment, even then it's difficult. And even then you get treated like you don't know what you're talking about, or that we're the experts. So yes, Scott, I completely agree that for people who've never been in what chance have they got of who don't know what to say and don't, I get it. Well, it worries me, that system.
What about you, Evie?
Oh no, I completely agree. I'm just thinking, I had similar experience, and there is just a beautiful, like you said yourself, that beautiful little small kindness of actually listening and just trying to find a way for you if you can't yourself physically do that. I remember once there was, because I didn't go to toilet for 21 days, it was a little scrimmage, it's not going to be very descriptive, but not maybe pleasant for some people. You can imagine what it does with your bowels, not to be able to go for 21 days to toilet. And finally, when it happened, I ended up with hemorrhoids, and I never had that. I even didn't have a baby. So like, what the heck is it doing down there? It shouldn't be there. And it's painful. And to me, it was huge. And, but it was also very embarrassing. I'm a young lady, girl, woman, whatever. And, and there is this thing that shouldn't be there. And I'm thinking, what the hell? And it was really painful. Oh, excuse my French. I shouldn't swear, sorry. And I remember it was evening. And so I called my lovely friend, my lovely Sylvie, I think it was at the time. And I trusted her, and I confided in her that I'm A, really worried about it, B, I don't want it there, C, I know there are worse things happening around my body, but at the moment this is really important to me, and D, can she give me something for it to go away? And I was told that she cannot prescribe this, that there is this amazing cream, if I apply, it will be a magic happening. But this magic to happen needs the doctor. And she pointed over, I remember, across the world, and there was this beautiful, handsome man, young doctor, and I looked at him, and I looked at her, and I said, this person is never going to see what's going on down there. Like, never, ever. I'm not having it. You need to find someone else. And she said, but it's the doctor on the ward. And I'm like, yeah, well, it's not happening. I know everybody's seen everything. I had so many operations by now on my pelvis and all over my body. And she really listened, and she actually went over to the next ward, and she got, there was, again, all male doctors, but she managed to get like some very, very, very senior lady nurse that came over, checked my intimate area, find out that it's apparently really tiny. I was like, no, this is huge. This needs to go. And she listened, she got me the cream, and the problem was resolved. So from this point of view, that was amazing to have someone who, yes, at first said, it needs to be done this way because this is the doctor on the ward and it's for this ward. And I was like, no. And she recognized that I'm not going to budge, and it's really important to me. And she found a way how to deal with it. But sorry, guys, I keep pulling out some embarrassing story. Oh my God, this is actually in public. So,
no, I think this is a great.
People.
Yeah, I was going to say also, this is a really true insight into what it's like when you get people who've lived with illness together. Where like this is one of the great things. Peer support is, I'd say, about 45% about bowels.
It is, because all this medication makes you so constipated. And by the way, if you guys listening and your lovely medical staff is telling you drink because you will be constipated, they're not exaggerating. Do drink a lot, like a horse, because it, in the long run, it's going to do a magic for you.
Horses drink a lot?
Well, apparently
like
so.
A horse.
You have this English saying, you know?
I think you mixed your metaphors there, Avi, but I think
Is
that's
it a
me.
cow?
Let's move on.
Oh.
So let's look at what we did to feel normal while we were in hospital. So did either of you do any kind of little things to help you feel normal while you're in hospital? Did you do kind of, were there any little things that you kind of had with you, or little things you would do? Claire, let's start with you.
Yeah, I mean, I've had a couple of spells where I think as a result of treatment, so I was in hospital for nearly 18 months, 2 years for the cancer treatment, and then later on I got this stomach where my stomach just stopped working, and I was on a gastro ward for a year. And so I was just thinking back to my bed area must have been a health and safety nightmare, because I brought in everything I could to make it not feel hospitally. So I had, I had fairy lights, and I had my pillows and my covers, and what else? Bed, like quilts, like pillows and things like that, to make it feel like it was my space and not the hospital's, which probably is awful for like infection control, I'm sure. So I definitely did that. And interestingly, I was thinking about this because when you said, oh, we're going to talk about the hospital bubble, it reminded me of something I'd almost forgotten about, weirdly. I'd got MRSA, and I've had it on and off, and they were doing a trial in a hospital, and they literally put me in a hospital bubble. So I was on a ward, and and they were trialing this system that meant you had a kind of like a tent structure over your bed, so that within the ward you were in isolation, and it was a trial to see if MRSA could be contained in the ward. So I was literally in a bubble with this kind of weird tent walls, and they had like a little hole they passed your food through. There was a commode in there.
Wow.
It was insane.
Oh my God, that sounds terrible.
It was pretty rubbish time, but I think the only way, I mean, that's kind of an even more intense, limiting your space than you'd probably even normally have. So again, I made them let me put fairy lights, and fairy lights seem to be my go-to personalizing a space. But also for me, pictures of me when I'm not sick. I always used to, I think it's partly for me as a kind of, remember that you're not always a patient, and you have a life outside this, and it isn't all you are. This whole world will be, you will live outside this world again at some point. And then honestly, it's also part of the thinking is like other people can see also that you're not just a patient, and you have a life, and you're an individual. And so those things kind of trying to normalize the environment, I guess that is, isn't it?
Yeah.
Yeah.
That's really nice.
How about you, Evi?
Well, for me, it was, this is going to sound very funny, but I love nail polish, whether it's on my toes or on my hands. So for quite a while, I got away. I don't know, I don't understand how, because I had quite a few operations quite early on, and I still managed to keep my nail varnish on. But there came a point within, I think within like 10 days after my first few operations, where they took it off. And okay, I can live with maybe, normally my hands would always be covered with it, but my toes, and because I couldn't move, I was bedbound, and I couldn't even sit. But all I could see at the end of the bed were my feet sticking out from underneath the blanket, and I had these ugly green socks, which were actually really comfortable, for the blood cloth, against the blood clot thing. But they don't have, they're not horse socks. They have holes around your toes. And I have really long toes, and they were sticking out like a sore thumb. And I could see them not being painted. And I hated it. That was the only point I could see, except fellow patients on the ward and stuff. I couldn't really see my body properly, but I could see those toes. And they did them for me, and I had a lovely red color every time I could. And it was such a little thing, that was small thing that really mattered to me. And because I'm a big reader, but I couldn't read. I had books there, but at that point, I would get really frustrated because I couldn't do something I loved. And so that wasn't they thought they're doing a good thing, but I had to explain. And it took a while because I was embarrassed too. They were so happy, so I couldn't tell them. But when they learned about that, and then that earrings were really important to me. They were just because I couldn't look after myself. I wanted to feel like a woman again, which was nail polish and my earrings. So that was my go-to. And then my family and friends, because they couldn't visit as often, I would get lots of cards. And I remember my HCAs on the wards, they went into trouble. They found blue stick and they just covered the wall around my bed with my cards from my people, because that was who I was. I had friends and I had family. And as Claire said, I wasn't just bed number 22. I wasn't just broken pelvis. I was Evi, and I had friends and family, and I was a woman, and they made it happen. But I had to ask sometimes, and it's nice to be able to ask, not to be afraid. So that was my go-to. Then, of course, it broadened up as I was getting better. It does get better, people. You don't get stuck with nails and cards only. What about you, Scott?
Yeah, I think for me it was things like being able to wear my own clothes,
Yes.
like not having to wear hospital clothes. When just so after my stroke and when I was on the kind of big rehab stint, being able to have a proper duvet and not one of those horrible kind of plastic lined duvets made a big difference to me. And it smelt of so it was like the duvet cover came from home, so it smelled of like fabric softener from home and stuff like that, and just just made me feel a bit normal. The other one, and again it comes back to food, I'm afraid, but the hospital food wasn't up to much, so my mum would come down pretty much every evening and bring she would bring me dinner down. So I wouldn't have hospital food for dinner, but she would bring me down some food instead, which was like an hour journey each way. So it was a real labour of love from her to do that for me. But it was I think she realised how important it was for me to be able to do that as well.
I get that. My friends, Ivana and Katarinka, they would drive an hour to bring me home cooked soup. Oh, amazing.
Yeah.
Oh, I wasn't half as virtuous. I would just get them to go to Nando's or the restaurants not available. But yeah, the arrival of like a brown paper bag for the takeaway is just amazing.
I mean, honestly, those little things, right? They're huge. And I'm just slightly aware of the time. But what I really wanted to talk about as well, if we look back now, as well, I don't want to lose this point. Is there anything we would do different? And also, I feel like I learned a lot by being in hospital, but looking back with reflection, because at the time I didn't realize that's what's happening to me, but I used my skills without even knowing I'm using them. Like I'm being a very positive person and I'm a very action taken person. So I wouldn't be just sitting in bed waiting for people to happen and tell me what to do. When I couldn't move, I remember all I could do was bit of with my arms. So I would have my heavy toiletries bag finally when I had one, and I would just lift it up and down to do something. So have you when you look back, would it be something different you would do? And did you use any skills? What did you learn about yourself through hospital stay?
Oh, it's a big one, hey.
I know.
I think the things I would do differently, and to be honest, I still have to work on this when I'm an inpatient, is my instinct when I'm feeling really yucky is to not reach out to people and not sort of get the gang in to come and see me. I mean, and I say this to people to kind of explain it, is to sort of think, when you've got a really rubbish flu, do you really want people coming and sitting in your sitting room with you and sitting by you, you know, while you're laid up on the sofa, like being sick or whatever it is? Your instinct isn't really to invite the world in, is it? It's kind of to shut the world out a bit until you're recovered, because you know in that instance it'll probably be a few days a week. And I think that's part of my problem is even if I was in hospital in January, February for a month nearly, and I had to really go, actually, you've got to let other people into this world. And it's something advice I'd give to myself when I started out on this crazy journey, is that it's all right for people to see you not at your best, and you don't have to entertain hospital guests. You know, it's not your job to kind of...
Yeah. You can follow through if you want.
Make it into... Yeah, it's like I'm there doing a stand-up routine about all the people in hospital. Like, no, it doesn't matter, Claire. It's okay if actually, you know, you need to go off and throw up, or you need to, you know, like it's some horrible, obviously, stuff to people to see, but it's allowing people to support you in those moments, I think, because whilst the hospital staff are brilliant, they don't give you that, they can't really give you that companionship. And I think that's such an important part to stop the isolation of illness, being ill. It's just so, it can be so isolating. And so that's something I change. I think something that I've learned and got good at, I am now really good at waiting, because I think, I mean, you know, if you think of the one thing that kind of sums up a hospital experience, is effectively you are just waiting the whole time. You're waiting for the next ward round. You might be waiting for, it's all broken up by schedules, and you're waiting to see this doctor, you're waiting for that referral to come through, and then you're waiting for the discharge, and then you're waiting for your TTAs, and then you know, it's one long waiting room. And if you're in that waiting room for 9 months, you know, you've got to find a way of not going mad, haven't you? Because it's just, it's really challenging, and it's really exhausting, constantly not knowing what's coming next, but always waiting for the next thing. So I think I've done quite a good, I guess, self-improvement course that I didn't ever sign up for, on getting better at being in the moment, being patient, finding things to occupy yourself, trying very hard not to project too much and think forward about what is going to happen, because obviously you don't know, kind of deal with it when it happens, not 2 weeks in advance, because that's a waste of energy and time. And so that's something that I feel now I kind of, not through any ambition on my part to get there, but I feel I've got quite good at it, you know. Not something I have really, but just through experience you get quite good at really trying to bring yourself back to the moment, and how do I feel right now, and deal with that rather than all the rest of it.
Yeah, totally. Agree. What about you, Scott?
So for me, a really big one is learning that it's okay to not be okay, and that it's okay to rest as well. So I would get really wound up at myself when I was really tired and thinking that I had to go to my next therapy session, even though I was absolutely exhausted. And if I didn't go to my next therapy session, then I wouldn't get better. And eventually there was a bit of a light bulb moment that happened for me, that was actually, if I don't rest and I go to this next therapy session exhausted, I'm just going to get more exhausted. I'm not going to be optimal for that next therapy session, and I'm just going to get more and more fatigued. So actually what I need to do is just rest now, not go to that next therapy session, so that I'll be in a better place for the next therapy session. So I've got much better, and realizing that actually being in hospital is really exhausting. You know, the kind of constant hubbub is something that really zaps your energy, not to mention that, I don't know why, but they insist on making hospitals like furnaces. They all seem to be 1,000,000 degrees, which seems to just sap your energy. So yeah, realizing the importance of rest, and although the kind of the medical professions might have set out a schedule for you, that doesn't always take into account the schedule that is best for you. So you kind of need to recognize what the schedule that is best for you is, and then kind of try and make things fit in around that. But also try not to lose your sense of who you are, or who, like, your kind of sense of identity, and not kind of like remember who you are outside of hospital as well, and try and bring that to the person that you are inside hospital, and try and show that person to the people that are working with you in hospital, because that will help them to help you on the things you're working on, and will give them an idea of the kind of person that you are and the kind of things that you like to do, and maybe some of the things that you should be working on together. If they can see some of the things of your personality and the things that you like to work on, then that will kind of help mold some of the things that you can work on with them, really. And then food, really get as much good food as you can, because the hospital food, the hospital food is naff. So
By the way, can I just nip in there? If you have you ever been to Stanmore Hospital, guys? I can recommend they even have menu, like proper menu and choices of desserts, main courses. It's incredible. That's the only hospital I know so far that's got amazing food.
This podcast is not sponsored by Stanmore Hospital.
Yeah.
Oh no, it's not.
Just set up a TripAdvisor for hospital. Food.
Yeah. That's another idea. We could do a hospital food rating system.
Yes, we could do reviews and go around and check. But sorry, Scott.
So that's pretty much it for me. Yeah, get as much good food as you can, because also getting decent nutrition is kind of how you're going to get better in hospital as well.
Yeah.
What about you, Evie?
Well, for me, as you mentioned yourself, guys, as well, for me, when I look back, I remember I used to freak out about the future a lot, because, as I mentioned, there were no really clear answers, no really clear timeline. And with the way my recovery was going, with so many setbacks, the timeline was getting later and later and later. And one incredibly useful thing that I was told by my amazing psychologist, Vicky. She was a tiny, tiny, beautiful, very soft-spoken person, but oh my God, she was strong and clever. And she told me, I really freaked out about it, was, as you mentioned, Clare, don't think too much in the future. Yes, it's important to have a goal of where would you like to be at some point, but what really helped me, and even with pain management, minute by minute, literally, just let's get through. In my worst moments, I would just think, okay, let's do a minute. And in a minute, I would think, let's do another minute. And that just got me through a day. And all of a sudden, the day was over. And I thought, okay, let's do another day. And it's sometimes really hard to do, especially if you have family. If I needed to support myself, I had no one to help me here. Or if you have children and stuff, I get it. But it might give you just a little bit of relief, and it certainly helped me. Another thing I would do more that I didn't, but I learned along the way, and I think I got much better at it, is talking about my fears. Be really open to my practitioners, but also to my family, because I was very closed off to my family. I would tell everything to my fellow patients, maybe 80% to my medical professionals, and about 10% to my family members. Because A, I thought I'm already a burden. B, they don't need to be worried. They already are. C, my medical professionals, they are very enthusiastic because my recovery is going so well, which I didn't agree with, because I wasn't where I wanted to be. I always wanted to be further. So I didn't express my fears enough. And I think if I did, and I learned if I did, whether it was just a silly little fear I thought it is, but actually it could be stopping me from doing physio. It could isolate me. It led me to being depressed. But if I found myself early enough, brave enough to talk about them, because not always you being asked what worries you or what stops you from doing X, Y, Z, I think that would be really helpful. And it did work out when I landed eventually. And I think third, I mean, there's so many things we can talk about, isn't it, guys? But I think another thing, and that was mentioned by you too as well, this is not how it's going to be forever. There is the light at the end of the tunnel. There is the new normal, if we talk about it. And I like the term because I knew I'm not going to be the way I was before. I was hoping, but just keep thinking of, I want to be like I was. It just led me to a lot of disappointments. It could give me direction, but it wasn't happening, and I would get really, really sad about it. So actually finding that it will be a difference at the end of the day, at the end of the month, at the end of the year, there will be a difference, but it will be a slightly different difference. And it will be my new normal, and it's okay. And this is not the way it's going to be forever. And that's really nice to find that there is always a way. Maybe I can't do this, but I can do something else instead. Or maybe I can do this, I just do it differently. So just keep trying, and it's exhausting. And as Scott said, if you're tired, then just rest and then just try again. What do you think?
I completely agree with that sense of it's become, I've given myself like this little mantra that is, if I'm at my lowest point, when I'm really feeling like I cannot hack this anymore, this is just too hard, this is too much, and nothing's ever going to change, because that's how you get. Yeah. I quite quickly get there, even though I know my experience tells me things will change. I just get myself in and I'm like, right, every minute, every second, like exactly like you said, second, minute, hour that goes past, you're that much closer to a time when you will feel different. And that almost, it's become something that's almost enough to pick me up out of that and go, oh, it's like a comforter, you know, like a little, a phrase that it's familiar to me, and I know I've used it before and it's worked. And it's always, you know, I know it's the truth because I've told myself, not someone else. So I think finding those things is so important. Finding those little thought patterns or just phrases that you can hold on to get you through those moments is really, really important. It's a really good point.
And I'm just thinking, all these poor you guys that are in hospitals probably at the moment, and some of you probably have no visitors at all or very limited. Yeah. Well, this is our message to you as well, isn't it? It does get better. What else? Find your little things that can make it bearable there, whether it's fairy lights, like Claire, or whether it's bacon sandwich for Scott, or nail polish, nail varnish, or you medical professionals, if you're listening, stop and say quick hello, have a little chat. Just a normal conversation, isn't it? That makes a difference too.
It's about finding those little things and then being confident enough to ask for them. If you think they might be a little bit awkward to deliver, or they might not quite fit in with hospital policy, it's like, actually, there are ways around things. It's always worth asking. Something there might be a no. There might be a no to a request, but it doesn't hurt to ask, does it?
What do you think, Scott?
Completely agree. Yeah, it's always
you
worth
look very
asking.
Cheeky. I have a feeling there is something in your brain that you're going to say.
No, it's always worth asking, and they can always say no. And normally, there's always a way around it, even if they do say no as well.
Yes, and absolutely. You know, guys, because I didn't have my family, or they couldn't visit because they weren't physically in England. But I remember I always asked, whatever progress I was doing, like learning to sit or stand, I always asked whoever was around me to take a little video, and I shared it with my family and friends, and that they made it happen for me. That was really cool, and it kept me in touch with my family and my progress, and that was really important. So if you can do that, I recommend that's a really awesome way to stay in touch if you can't see your loved ones. Plus, it's a great memory to record. I still go back to those moments and I think, oh my God, I actually did amazing.
Yeah, I think we are relatively, when I compare what it was like when I was very first admitted, and I didn't even have a mobile phone. I got my first mobile phone in hospital, I remember, just to call my mum and dad to tell them how I was. And that was, and you could play Worm. That was all you could do on it. There was no other, it was like one of those old clunky Nokia bricks. Compared to now, when I go in and, you've got Netflix on tap and you've got Skype and you've got Zoom, all the things that use all those things, because they really do. Just seeing people's faces, if you can't see them in person, as we're all learning, I guess, during this lockdown, what it's like to be cut off from people and use all the same tools in hospital. That's the reason why you can't.
Yeah.
Brilliant. Well, I think that's a good a place as any to end it. So thank you very much to both of you for your input. I think we'll
And you.
go. Oh no, that sounded a bit fatal, didn't it? We'll bring the podcast to a close. Yeah, no. So Evie, where can people find you online? What are your social media handles?
God spot. You know what? Every time I'm being asked this, my brain goes blank. I blame it totally on my major trauma experience. And
so your Twitter handle is Evi_Machova?
I think so. I would have to open it. So I apologize to everyone that's listening.
Smooth.
Can I still use the excuse of being injured?
Yeah.
I think I can. That's my cognitive problem.
I blame chemo brain for everything, and I think
you can use it. Whether anyone believes you is a different matter.
See, guys, silver lining in everything, in all our illnesses. So yes, it is EVI_ and then my surname MACHOVA.
And your Instagram?
Oh God. And my Instagram it's SLLU and for November ICKO, which actually means sunshine in my language, which is Czech. So that's that. And then you can find me also part of the Bridges the Instagram, which is what I'm sure you must.
Yeah, I'll talk about that in a second. Claire, where can people find you online?
I'm on Instagram and Twitter, and I've now combined it, so I've got the same name to make it easy, and I am at The Wheezy Life.
Brilliant handle. So have you retired sick as a dog?
Sick as a dog has been retired, because
I like it
slightly negative in tone. The Wheezy Life is now me.
The Wheezy Life.
I like that.
Okay. Brilliant. And I can be reached on Twitter at Ballard-Ridley and Instagram at Dad Can't See if you want to see any picters of me and my daughter getting up to mischief.
Oh, awesome.
And Bridges can be reached on Twitter at BridgesSelfMGMT. We can be reached on Instagram, where we are trying to build a bit of a patient, what would you call it, Evie? A patient forum, a patient group?
Patient voice?
Trying to tell a patient story. Patient. We need to do a bit of a better, snappier branding.
It's just us being honest about our daily struggles and what we went through and what helped, what didn't. And you guys can take from it whatever helps you or doesn't. And
so we can be found on Instagram at BridgesSelfMGMT. We have a Facebook community of practice. So if you search for Bridges Self-Management Community for our Bridges Community of Practice, you can look at our website at bridgesselfmanagement.org.uk. And if you want to email us, you can email us on admin@bridgesselfmanagement.org.uk. And if you've enjoyed the podcast, you can please subscribe on Apple Podcasts, Spotify, or wherever else you get your podcasts. And please rate us and maybe leave a comment or two. That'd be brilliant. We'd love to read some comments and hear what you've got to say about our ramblings on this. We're going to have some more podcasts coming up soon on various different topics. So it's not just going to be the three of us chatting about our experiences. We're going to have some different topics coming out very soon. So yeah, I think that's it. So yeah, thank you very much, Evi and Clare.
And thank you, Scott, and everyone for listening.
Yeah, thank you everyone for listening, and yeah, we'll speak to you all again soon.
Yeah, bye-bye.
Bye.